So let's take a look at a case of a cervical spine x-ray. So here we've got a lateral view of the cervical spine. Now it's important to have a checklist with these, which I won't go into too much detail, but we can have a look at the vertebral body heights first of all, which look okay. There's some degenerative changes with anterior osteophytes. Next we have to look at the alignment, so this is really important. So we can use the anterior spinal line along the anterior cortex. And here we can see there's a step between C5 and C6. Next we can have a look at the posterior spinal line. So again along the posterior cortex, again we can see that there's a step between C5 and C6. And then the spinal lamina line, which is difficult to follow. So we can see that the C5 vertebral body has moved anteriorly over the C6 vertebral body. Importantly, there's also widening of this interspinous distance here. So when we have a look at the facet joint, we can see that the C5 facet is perched on top of the C6 facet. So this is a case of a perched or a sublux facet joint. This is an unstable injury with disruption of the posterior ligamentous complex. Perched facets result from hyperflexion, lateral compression, and rotation injuries of the cervical spine. Importantly, any further subluxation is going to result in complete dislocation with one facet jumping over the other and becoming a locked facet joint. In terms of management, this needs to be immediately immobilized with further CT to identify for bilateral involvement, any fractures, and also potential MRI if there's any neurological deficits to look for injury to the cord. They'll need a spinal surgery consult with urgent reduction. You can have a look at the full CT at radcases.net.